anatomy here a little bit, or remind ourselves of the anatomy. So we said that they are thin-walled. Veins have thin walls. They have a large diameter. And they are a volume reservoir, so they are high volume. Okay. We also said that veins have quite a few unique challenges. So let's talk about some of the challenges to venous return. So we said that they work against gravity. So gravity is one challenge. We also said that they are low pressure, right? Going back to our pressure gradient, we know on the arterial side of things, pressure is high. On the venous side of things, pressure is low. And so by natural default, veins have low pressure. And that kind of works against venous return. We also said that they are high compliance. And that high compliance has to do with how much pressure the wall is exerting on the venous blood. And it's not very much, right? Veins are very obedient. They don't exert a lot of pressure on the venous blood. And that too works against venous return. Okay, so these are challenges in the venous system. Let's look at the compensatory mechanisms, right? So what are the mechanisms we talked about that kind of correct these challenges? Okay, so what are the mechanisms that we talked about? Valves, yeah. So the valves, and then the valves are working with another factor. The valves is working alongside something else. The skeletal muscle pump, exactly. So the skeletal muscle pump. Okay, and just to describe this a little bit further, we said that we have skeletal muscles in our peripheral limbs, right? Where we have those peripheral veins that also have valves. Remember, there aren't any valves in the central veins. And so the muscles, as they contract, push against the veins. And as they push against the veins, we have the proximal valves opening up, pushing blood towards the heart, and the distal valve closing, preventing any backflow, okay? When the muscle relaxes, we have the opposite happening. We have the opening up of that distal valve so that more blood can come into that area, and we have closing of that proximal valve so that we don't have backflow of the blood that we just squeezed out of that area. So together during contraction and relaxation, the valves and muscles are working to keep blood going to the heart, to work on that venous return. Okay, what else did we say about was another mechanism of working against these challenges? What was the second mechanism? So this one is closer to our core. Well, one of them was closer to our core. What was that called? Yep, so the respiratory pump. And again, just to describe this further, the respiratory pump was two compartments. So the abdominal cavity, the thoracic cavity, and the pressure gradient that was created in the vessels across that compartment. So when we inspire, we bring air into our lungs. And if you take a really deep breath, you can feel this in yourself, right? You take a really deep breath, air comes into your lungs, your abdominal cavity compresses, right? The diaphragm goes down and puts some pressure on the abdominal organs. And you basically squeeze those organs against the veins that are in your abdomen. And what that does is it creates high pressure in the veins in the abdomen and lower pressure as you expand the lungs and you release that pressure in your thoracic cavity. So we have a natural pressure gradient as we inspire. And blood is going to be driven from the high pressure of the abdomen into the low pressure of the thoracic cavity. So this is the pressure gradient that we speak about with regard to the respiratory pump that drives blood back to the heart, that encourages venous return. Okay? All right, the third factor was more intrinsic to the veins. I think I'm hearing Blood volume was another factor, yep. Blood volume was another important factor. And just to describe this one further, we said that if we increased blood volume, this would increase pressure, which would increase venous return. And if we decreased blood volume, we would decrease pressure and decrease venous return. So this is another factor that can help to correct our challenge. But what's another intrinsic factor to veins? Yep. The venomotor tone, yeah, perfect. So the venomotor tone. And we said the venomotor tone was the smooth muscle layer inside the veins that was able to constrict, right? It was able to contract and put some pressure on that venous blood to get it back to the heart. This made veins a little bit high, decreased the compliance, right? This decreased the otherwise high compliance. Okay, it made veins a little bit more elastic. Okay, a little bit more forceful. So they kind of pushed or nudged that blood along towards the heart, which is not what we typically see in veins, right? They're really high in compliance. So these are the factors we spoke about with regard to veins and how they overcome the challenges. I do want to point out here, though, that the skeletal muscle pump and the venomotor tone, they're bringing about the same response, but they're different in the way that they're doing so, okay? The venomotor tone is intrinsic to the vein. The vein is doing this because of its contraction of the smooth muscle layer. So blood is being squeezed because of the vein itself, whereas the skeletal muscle pump is external to the vein. Okay, so make sure that you're making that distinction. The veins are pressing on, the muscles are pressing on the vein, and so this is an extrinsic factor that's helping to encourage venous return.